everyone, I'm Haben Debessai. I'm here with Dr. Dotters-Katz. We are going to be talking a little bit about tropical infections in pregnancy, but we also wanted to hear a little bit about Oropouche, this different virus that we've seen kind of in the news. I think this was more last year, but definitely still something that we want to kind of touch on and cover. But if you wouldn't mind introducing yourself for our viewers, and we can kind of learn more about what you do.
Yeah. My name is Dotters-Katz. I am a maternal fetal medicine specialist at Duke, and my clinical interest is in infectious diseases. And I initially actually started off as a first-year resident. I just love zebras, and I think I was on my ultrasound rotation, and I don't know, maybe saw some weird like arthropod-borne disease, and one of my mentors was like, you could write a paper about arthropod-borne vector diseases, and I was like, oh, okay, and I had never written a paper before, and so then I got into it, and I was like, wow, these are so interesting, and have sort of continued a passion for these sort of emerging tropical diseases, which it feels like every couple of years, sort of a new one comes out. We had chikungunya, we had Zika, and now we have Oropouche, and so it's been really interesting to kind of watch that all emerge.
Yeah, absolutely, and I think much to your point, especially in our population, seeing it in pregnancy, obviously we see non-pregnant patients as well, but I think it's fascinating to think about kind of the effects that we worry about in pregnancy in particular. I know this happened a lot. There was a lot of concern around Zika in pregnancy. We think about it for even dengue, right? The effects not only on the fetus, but on the pregnant person. So I think that this is really a huge gap, but also a really important one, as we know people are traveling more, all the baby moons that people go on. So it's a very helpful gap to kind of fill. So in particular, I know that recently that you kind of helped kind of produce a narrative review, I think, on Oropouche virus.
Yeah.
And so for folks that don't know, this is a mosquito and also biting fly, what they call it, a biting midge.
No-see-ums.
Exactly,
Call it.
exactly. So vector-borne illness that we have seen for a while, typically more in Brazil and South America. But in the last year, we were starting to see, especially due to travel, that some of those cases were actually coming up to the US and other kind of general areas in the Caribbean. And so I think what's concerning is that, similar to the way that we worried about Zika, there are some congenital effects that we have seen from Oropouche infection. And it's hard to really parse out because a lot of the symptoms are similar to other tropical infections we see, like chikungunya and dengue. So it was a little bit of a tricky one for folks to kind of track and surveil. So I know we talked about this kind of offline, but you haven't seen a case, but what are, I guess in terms of, these new, I shouldn't say new, but maybe new to the clinical US world, infections, what are the things that you look for in terms of how to educate and kind of keep other clinicians in the know? I'll start there.
That's a great question. So I think I actually fully think is, what I will say is, I think what helps me a lot actually is the mass emails that I get from the CDC and from SNFM about emerging infectious diseases. As an ID nerd, I always open them. But even if you aren't an ID person, I think it's important to look at them because, just as you said, there's a lot of sort of blurbs of here's this new virus. I had never heard of Oropouche before I opened this, and I was like, what is this virus?
Yeah.
And like you said, it does have these really big effects. So I think for clinicians, something as easy as just opening an email can be a really good educational tool.
Yes, absolutely. And I think it's helpful to have in a way that also helps not only, kind of tenured physicians, but also a lot of the trainees. It kind of is a useful way to remember this is how we kind of continue that lifelong learning. And there are going to continue to be things we do not know, but understanding that track of how to, if you are worried about a case, if you're hearing about travel, what's the route that you go to, right? How do you utilize your public health department, local health departments? How can you contact them and figure out the next, reliable steps? So I think that's really important and super, super helpful. Can you think of, I guess, especially in the work that you do in tropical infections, and again, as we become a more smaller world, what are some things or gaps that you feel like you've seen in the work that you've done that you feel like we still have not really broached yet in terms of whether it's research or
it's a great question. I mean, I think in the clinical space, it's really important to be thoughtful about travel. And a lot of you sort of touched on this, but a lot of patients say hey, is it safe for me to travel? And I think often when we think about travel, we think about DVT or how far are you from the closest hospital?
Right.
We don't necessarily think about, what might be in the place that you're going that could be potentially unsafe for you.
Yes.
The other thing I think for a less specific audience is in a preconception counseling space, or for the couple that's considering pregnancy, a lot of these tropical infectious diseases are actually in the semen as well.
Yes.
And potentially can be sexually transmitted. And this is a research gap in that we don't have a lot of cases in the US. It is hard to study that, but Zika was found in the semen, Oropouche has been in the semen.
Right.
A lot of these infectious diseases can be potentially in the semen. There's recommendations about condom use or abstaining from pregnancy for at least 6 weeks, I think, after you return from a place before attempting conception, because we just don't know.
Exactly.
So I think when you're asking patients about travel, or patients ask you about travel, not just is it somewhere that's safe to go from if something happens in your pregnancy, are you close to a hospital perspective or in a DVT perspective from a movement, but also what potential vectors might be there, and is that a safe place to go from that? And also in the preconception space.
Yes.
And then to answer that question from the second perspective, I think there's a big gap in research because we just don't know. These are emerging, which makes them interesting from a research perspective, but scary because we don't know. So
we don't know. Yes.
You know, we are basing our thoughts with Oropouche specifically about some case reports of stillbirth, of congenital anomalies like microcephaly, you know, of it's being found in the semen. But we don't have big population-based data, so we're giving very preventative, which is smart, advice, but I think that's the research gap. And that's how a lot of these start. If we think about how Zika started, it started with case reports and case series, and then we were able to get more population data as it became more prevalent. We're like, oh, this is really scary.
Yes, absolutely. And I think that's a really great lens into the fact that these things are still kind of rare, right? We're not seeing it on a mass scale. Thankfully, yes, hopefully not. But I think it is really concerning because a lot of times we don't love a lot of uncertainty, especially in our field, but just in our community and society in general. And it becomes really hard when we don't have the answers for everyone. So there is a lot of, you know, we're in a space where we're still finding things out, we're still tracking things and tracing them. So I think that's really helpful to hear, and really important for viewers and for also, you know, the greater population to hear as well. So yeah. Well, I mean, this is maybe not super like a question, but I think one other thing that's really important when we're talking about counseling patients on travel is also things that they can do that are preventative, right? So making sure that if they're going to be in an area that has those vectors present, using mosquito nets, using EPA-approved bug spray, those things are safe in pregnancy, and then also understanding that there may be certain activities you should avoid, right? Maybe not going and hiking in areas where there can be ticks and that type of thing. So it becomes something that is a longer counseling session, and we understand that. But I do think, especially in this world we are starting to see a rise in all of the different vector-borne illnesses. I think it's really important for us to keep in mind as OBGYNs, but also as public health folks.
And I'll add to that, I think from an Oropouche perspective, we haven't seen any cases of transmission in the United States, or anyone who has the virus who has not left the United States who hasn't.
Right.
All of the cases that we have here are people who have traveled to areas, been bitten, and then come back. And as our temperature rises, we've seen this with a lot of our tick-borne illnesses and some of our mosquito-borne illnesses, they're all moving slowly north as these vectors move slowly north. So that we haven't seen it yet, it doesn't mean it won't be here.
That's right, exactly. And that's an important fact as well to bring into this, which, you know, brings a whole other
discussion for a different day.
A whole other bag of bugs. But I do think it's really useful to have that lens for especially me as someone who's earlier in my career about thinking about what are the questions, what are the gaps that are still there. I think to go back to what we were talking about in terms of finding evidence of Oropouche genetic material in semen, and also seeing the same thing when we talked about Zika. I remember that was very surprising to me as a trainee to be like, oh, I didn't even think that this is something that we would be finding. It makes sense with bodily fluids, but that is a gap for sure that we still don't really understand if it's actually transmissible and kind of the downtrending effects. So lots of
so many good research projects, so many interesting things for us to think about as clinicians, but also as scientists.
Yes, and also so much great work that you've already done. So thank you for your interest in zebras, and also thank you for talking with us.
Yeah, thank you for having me.
Yes, perfect.